So this would be a patient with, mostly we call it golfer's elbow or forearm flexor tendinitis. He didn't get it from golf, but that's generally what we call it when you have forearm pain. He's tried a few different interventions. He seems to respond well to manual therapy, but today we're gonna up the ante and we're gonna use Shockwave. You will definitely feel this. I apologize in advance. It's not the most comfortable techniques. I'm gonna kind of start here, work up to that, skip over the bone, and then get the upper ends of it, okay?
Cool. It's not.
Bottom of the foot really sucks. So I was getting numbness in the bottom of my foot. I'm like, this is ridiculous, come on. Shockwave the bottom of my foot one single time. It was horrible, like a lot of pain. Instantly gone. No longer had it. Could run 5-6 miles without it. I was like, this is just insane. Shockwave is going to be used to break down the tissue or stimulate the tissue depending on the intensity that we use. This stimulation, this breakdown is going to help the tissue heal faster and loosen. What we're going to do is follow up this passive modality with some active therapies such as manipulation of the joints and exercises to increase the strength so this doesn't keep coming back for him. So this patient presented complaining of elbow pain associated with lifting at the gym. He's very athletic, he likes to lift, and he wants to get back to lifting. They likely got it by squeezing too hard on the bar. It's a common injury. What Shockwave is doing is breaking down the tissue and stimulating the tissue so that way we can have higher turnover and therefore heal it. We're utilizing the body's own systems to heal itself, which is what we do here. So with a patient like this, it depends on how long the issue's been there, but sometimes we can see results as soon as one treatment, but most of the time we recommend about 6 treatments worth. That way we can continue to stimulate the tissue and build it back to its original strength. Shockwave seems to be picking up a lot of steam because it's so immediate in the change that you feel. Sometimes it's 1 visit and instantly you're feeling better. Sometimes it's 6 visits. 6 visits is still miraculous when you've had something like a tendinitis for 2 years or however long you're dealing with that. So I really like to use Shockwave in chronic examples, tendinitis, plantar fasciitis, all situations that require a little bit more intervention than my thumbs can really give. And then we use lots of active therapies to follow that up and reinforce the right pattern so that our patients don't have to deal with this repetitively. Fortunately, in our office, we have a lot of tools available to us. So after Shockwave, a lot of times what we'll do is we'll add some laser in to stimulate the tissue to actually heal again. So we introduce a little bit of inflammation with Shockwave, and then we help fix inflammation with the laser. So this patient presented with something we see here all the time, whether they're lifters, athletes, office workers, moms, dads, it doesn't matter. This is the type of pain that pops up for people, and we're able to easily address it and fix the underlying issues. So if you're running into a similar problem, I suggest checking out Shockwave. We've got it here, we've got everything else you could need here as well. So if you need anything, give us a call.